7 weeks post hip replacement surgery. So how's it all been going? Well, went to see the doctor today. First follow-up one, the hip surgeon. Let's have a listen. Let's have a talk about what he said. So as you may recall, after a very rough start and after developing IgA vasculitis 1 week after surgery, which put me back as far as doing my post-op exercises and physio. We've made a pretty good recovery regarding the hip, I think. I'm, as I say, 7 weeks post-op. I've not had any real problems with pain. I have overcome the obstacles that was in front of me as far as walking, and the majority of time around the home I do not use a cane or any kind of real help. When I go out, I take both my canes. Sometimes I use one, sometimes I use two. That is more of a bit of a safety thing for me. It's more to make sure that I feel stable, I feel confident, and should something happen, having two sticks kind of, you can kind of regain standing properly. I have been really good. I have stayed in the goodness awful chair, no lounge chair, no recliner, just the Jerry chair, the straight back Jerry chair. And I must say that probably in the last week, at the end of the day, when I just cannot bear to be in that chair again, I have hopped over and sat on the lounge chair. And I do that maybe the last couple of hours. Otherwise, I'd go to bed those 2 hours just to get out of the chair. Mentally, I feel better, getting out and about a little bit more, visiting people a little bit more, feeling confident that I can visit people, that I can cope with their toilets, and how most of the toilets are low. So, I held back for quite some time because I didn't want to use people's toilets. So I'm out and about a little bit more, visiting, and I'm doing a lot more walking. I have to say that I don't do my daily routine because I believe that I've still got bad legs. I've still got a problem with the pains in my legs, and again, if I do use the sticks a majority of the time, it is because of the pain in my joints, my ankles, and just the general pain from the sores. Some still sores on there, but all in all, I think I'm doing really well. So today we went to see the surgeon. So post-op, my first post-op checkup with the surgeon. He's been well aware of the problems I've had with the vasculitis, and I was able to show him some close-up photos of how everything did get. I pointed out there was a couple of things we wanted to talk about. In the last week, it appeared to us that there was what we believed a stitch coming through. Now, I had dissolvable stitches. My surgeon tended to put a knot at the end, and I did have 2 knots. They were removed at the appropriate time. This area has become a bit inflamed, and you could definitely tell that it was a stitch, or how stiff the stitches go, and again inflamed. He had a look and he found another one as well, but he said that they were actually internal stitches that hadn't dissolved properly, and the skin was actually eliminating them, sort of pushing them through. And sure enough, when we left them alone. We wanted them to be there because we knew we were going back to him. When he got some tweezers and he touched them, they basically disintegrated. So his advice there was keep an eye on the inflammation. If it did get any worse, go to the GP and get some antibiotics. So that was all good. There was a little puffy, not a lump, a little puffy swelling that he didn't think was really anything. Again, keep an eye on it. I do have another follow-up appointment in 3 months. He was very happy that I had succeeded in getting as far as I had, considering, all things considering. I've been very happy. And if I didn't have this vasculitis and we hadn't had that problem, I think week 3 or 4 I would have been really on my way then. We touched on, okay, so week 7, when do I get to sit in an armchair, a recliner? When can I do slight bending to pick something up? And he basically said to around now, but don't force things and don't go full force into doing them. If you can sort of still get away with not bending, do that for longer. But especially the chair, you can sort of start weaning. So still majority hours in the chair and some hours in the armchair / recliner and that kind of thing. I told him that, I'm fully really looking after myself now, dressing myself. All I do is, because at the moment I can't get my legs wet because of the sores from the vasculitis, and what we're doing is we're actually putting my foot in a garbage bag. I've got both legs in one, each has a garbage bag, and we sticky tape it up so that no water can get inside or run down my leg. So what happens is, for showering, my husband helps me put my garbage bags on my legs, and he mixes the shower and gets it the right temperature, because I actually have got a hose adapter. So that means instead of it coming out of the shower, I've actually got it coming out of it's almost like a hose. And that it was a bit more, I can aim the water where I need it to go, rather than a shower head that's just falling straight down. I wash my own hair, I rinse my own hair, I dry my own hair. My husband hands me a towel. So I'm doing everything myself, and I'm very, very happy with that at the moment. I'm being able to walk further. I get myself in and out the car, even though the seat I still have as a backward reclining, as it was the first day I came home from the hospital. I'm leaving it like that for a while, but I'm getting myself in and out the car. I've been getting out for a while. It's just, and really the getting in was really based on the actual, the pain from the vasculitis and the inability to actually flex my ankles. So realistically, I probably could have started doing this a little while ago, but just the pain, it sort of, stopped me with that. I'm out and about in the garden. I walk a lot around and around and around in my garden. I've had my husband out there repotting for me, so I point, he repots. Got a great relationship. What else? Oh, my husband still makes me breakfast in the morning so that I have something solid to take the pills with. But all in all, I think it's been a very successful hip operation. I did mention to him that I feel like one leg is longer than the other. And he did say that happens occasionally, because over the time that you have a bad hip, you are usually trying to, you're hobbling, you're limping, you're trying to compensate. And sometimes the muscles around both your hips get pulled into different directions. And he said to just give it time and don't rush off and buy any inserts for your shoes, because they're not cheap proper ones, proper ones, not cheap. And you might just find that everything will realign a bit better as time goes on. So we're going to give that some time. I think that's about all as far as the hip. I think that's all about all. I was having a physio come in for a while to help me, a bit because of motivation and because I was behind because of the legs. But she's not coming anymore. We've, that was a great relationship. She was great, had some great ideas. But we got to a point where, I was seeing her once a week, and really it was just checking that I was still doing everything correctly, which I was. So I don't need that anymore. I'll be glad when I can stay off the toilet seat riser. I'm still using that in my home. However, when I'm going to other people's houses, I am having to sit more on their short toilets, but that's going good. All in all, I'm happy I had it done. I hope to goodness I never need another one, because of all that happened afterwards, not knowing what triggered the vasculitis. I'm very scared now of putting any chemicals or anything in my body, any medications, just because we didn't know what ended up triggering it. So, I think that's about all at the moment. I may or may not do any more as far as the hip. So if you followed me during this, I very much doubt you'll have the kind of problem that I had. I hope not. But I think it was worth doing. I was lucky that I had private health insurance, that I was able to get it done in a timely fashion. And every day I just got to get my legs better now to be able to walk, and that'll be about it. So thank you for following us through this journey. I hope your journey goes well, and I hope you don't have to wait a really long time. I think it's important, when it's possible, to keep doing your the exercises, and to try to stick to the rules. There's things you can do, there's things you can't do, and try to stick very hard. And mind you, my head has been filled up with all the medical stuff in the last 7 weeks. The time went really, really quickly. So thank you for joining. I hope that you are successful, and that everything goes well for you. So for now, bye-bye.